Hey guys, I'm Dr. Jeremy.
Dr. David here.
And today we're going to be talking about vertigo and chiropractic care.
So vertigo is something that people describe to you that they feel like the world around them are spinning, they feel a bit dizzy, and this is not a really good sensation. And this
Horrible. It wrecks people's lives.
Oh, I know. So this can be triggered by different reasons. So some common things that we see is something we call BPPV, where the crystal in your inner ear dislodged to somewhere they shouldn't be. And there are, for example, vestibular neuritis, inflammation of the nerve can also cause the sensation like this, as well as some infections or imbalances in the fluid around your ear. Yes.
Yeah, and another one's called Meniere's disease, where people have a lot of vertigo as well.
Absolutely.
And they're not really sure. It's just changes in pressure in the ear canal, and no one really knows why that one happens, but it's another cause of vertigo.
Absolutely. So there are some risk factors in Dr. Jeremy.
Yeah.
What are those?
So generally, vertigo happens as people age. Age is a risk factor for most things. Head trauma can be a risk factor. We can get different infections can contribute to vertigo. Some other things.
Medication is a big one, actually.
Yeah, that's true.
Yeah. Some of those anti-seizures
and
medications.
And blood pressure meds too. So there can be lots of different things that can set off vertigo, which can be really hard sometimes to understand what sets this off. There is some things that we can do about it.
So with chiropractic care, we know that we look after people's nerve system, and there is so much input coming from our peripherals into our nerve systems, and it's actually quite important for us to address those dysfunctions because when there are so many information coming from different areas, there can be too much to process.
Well, this is an interesting point that you make. We've got our eyes that tell us where we are in space, we've got our balance organs, and we've got our thing called proprioception that tells us where we are in space, which is all the 3 trillion signals every second that your body sends to your brain.
Absolutely.
And it's an interesting study.
And there's some studies that has indicated that chiropractic care is really good from 2015. Yeah, there was a study coming out that chiropractic care has really good results with cervicogenic headaches. So where there are some dysfunction, it's one type of headaches, there are many types, but in this particular type, we've seen really, really effective results for patients who suffer from the headaches and also with vertigo as well. In 2016, there was a study that shows significant improvement after their chiropractic care, their vertigo improved.
And that's really interesting because what that study shows was that if we improve people's neck function, remember I just said before that all the information coming from your body to your brain is one source of information that tells you where you are in space. So with your eyes, the balance organs, and the body sensations, and if one of those sources of information conflicts with the other, that's where a sense of vertigo or dizziness can come from. So where chiropractic care can come into it really well is if there's a neck condition causing some of that dizziness, we tend to see some really good results. And in the study David just mentioned too, there's some other results there, and sometimes dealing with different parts of the nervous system in other ways has been proven to get some good results as well.
Absolutely.
Yeah, so essentially what do? We give you lifestyle advice, we hopefully will help detox you. We also will do some therapy on your body as well if you come in here with the symptoms of dizziness or vertigo, and there's some ways that we can help you guys manage that because it's something you really don't want to put up with. It can really affect your quality of life. Absolutely.
So as we have said that there are many reasons why that you can have these conditions, and more research are always appreciated, always needed.
Absolutely. So if you know anyone with vertigo that likes us to help see if we can manage it from our angle, make sure you send them in, guys, and as always, have a great weekend.
Bye guys.